I'm a little surprised. I didn't know that masks were required in Nevada. I knew they were required, they were required in Nevada since Friday. Again, they're kind of responding to the new cases, which, in an ironic sense, new cases without new deaths means that this Covid-19 situation isn't as, just kind of reaffirms this Covid-19 situation isn't as bad as all the projections back in March. And people are acting as if it was this zombie apocalypse type situation like we thought it could have been back in March. But we see the numbers with the cases go up, which doesn't mean anything. We're all susceptible to getting illnesses, viruses. It really has to do with mortality. And if the mortality rate doesn't go up, then you have evidence at that point that it's just another type of flu or a cold type of situation. Although, which makes it even more strange, which is in the past 10 years we had bird flu, which is the H1N1, swine flu, or maybe that was H1N1, and then there was SARS, MARS. They were way worse. If you got MARS, I believe the statistic was you had a 40% chance of dying. So MARS, to a great extent, was a death sentence, especially in contrast to how people are reacting to this COVID-19 or SARS2. I see a lot of official news reports that say that it's not even 1% death. So it's not even a 1% mortality rate. Then we have some people, just in their arguments, kind of Twitter wars or something like that, you see people arguing that it's 5%. So I don't know where they're getting their numbers when the journalists and news outlets don't report anything over 1%. Well, what's going to happen when we have a flu season? What's going to happen when we get the cold? Are we all that scared of, like this year we're scared? Why weren't we scared the whole time? All the other, I wouldn't call it a pandemic just because it wasn't labeled that way, and I wouldn't consider this a pandemic either. But there have been, over the past 10 years, half a dozen viruses or flus or colds or contagions or whatever you want to call it that have been much worse. And there's been no reaction like this. So I'm very curious to see what everybody thinks, because I know there's varying opinions on the internet, and I can't see why there would be such a varied opinion, unless you're just not looking at the numbers. And I fully agree that the numbers probably aren't valid or honest. But if they're not honest, they're at least inflated. And we know the hospitals get more money for calling whatever ailment somebody comes in with COVID-19. They get something like 3 times the money. So even if you believe these official numbers, and the numbers don't show a high mortality rate, why are we acting this way? Whereas we didn't act anywhere near this way in the past.